Imagine waking up to find that your most sensitive health records, including social security numbers, treatment details, and insurance information, are being sold on the dark web. That's exactly what happened to the patients at BayMark Health Services, a healthcare provider that recently fell victim to a devastating ransomware attack. This week's Hack of the Week covers the ransomware attack on BayMark, where cybercriminals from the RansomHub ransomware group stole 1.5 terabytes of patient data and leaked it online after BayMark refused to pay the ransom. How did the attackers break in? What did BayMark do to respond? And how can healthcare providers and businesses protect themselves from similar breaches? Before we get into the details, subscribe to our channel for weekly cybersecurity updates and insights. Now, let's break it down. The BayMark Health Services ransomware attack didn't just happen overnight. It was a carefully orchestrated breach that unfolded over several weeks. The attack began on September 24, 2024. Hackers infiltrated BayMark's network, gaining unauthorized access to sensitive patient data. For nearly 3 weeks, the attackers remained undetected, moving through systems and exfiltrating files. On October 11, 2024, BayMark's IT systems were disrupted, signaling that ransomware had locked them out of their own network. By October 14, 2024, BayMark confirmed that a major security breach had occurred, and an investigation revealed that the RansomHub ransomware group was behind the attack. But the worst was yet to come. Instead of simply encrypting data and demanding a ransom, RansomHub exfiltrated 1.5 terabytes of sensitive information, including social security numbers, driver's license numbers, dates of birth, treatment details, and insurance records. With so many highly personal medical information at stake, the damage was severe. And when BayMark refused to pay the ransom, RansomHub listed them on their leaked site and released the stolen data on the dark web. Cybersecurity breaches often go undetected for weeks, and in BayMark's case, the attack lasted nearly 20 days before being discovered. The first red flag appeared on October 11, 2024, when BayMark's IT systems suddenly stopped working. As their teams investigated, they discovered signs of unauthorized access going back to September 24, 2024. A deeper forensic analysis revealed unusual network activity leading up to the attack, indicating the hackers had been inside for weeks. Large data transfers suggesting exfiltration of sensitive files before deploying ransom, encrypted files and ransom notes confirming that RansomHub had taken control of their systems. The timeline of the attack reveals a well-planned operation where hackers gained initial access through an unknown vulnerability, moved laterally through the network to access sensitive records, stole 1.5 terabytes of data before triggering the ransom encryption phase, and demanded ransom, and when BayMark refused to pay, leaked the data online. This attack underscores the dangers of modern ransomware. It's no longer just about encryption, it's about stealing and exposing data to pressure victims into paying. Unlike many ransomware victims, BayMark Health Services refused to pay the ransom. Instead, they took immediate action by partnering with cybersecurity experts to investigate the attack, worked with law enforcement to track down the perpetrators, strengthening their cybersecurity defenses to prevent future attacks. Their incident response included isolating infected systems to prevent further spread, conducting forensic investigations to determine the attack's full scope, implementing advanced threat detection to catch future intrusions early, notifying affected individuals, and offering credit monitoring services to help protect them from identity theft. While BayMark's refusal to pay the ransom was the right decision, the damage had already been done. Thousands of patients' data had been leaked, and the dark web is now flooded with stolen medical records. The BayMark ransom attack is a wake-up call for any organization handling sensitive data. Here's what businesses, especially those in healthcare, should take away from this incident. Ransomware isn't just about encryption, it's about data theft. Modern ransomware groups exfiltrate sensitive data before deploying encryption, meaning that even if you have backups, attackers can still leak stolen data to pressure victims into paying. Strong cybersecurity measures are essential. Organizations need to invest in endpoint detection and response solutions to detect suspicious activity, zero trust security models, ensuring that access is granted only on a need-to-know basis, employee training to prevent phishing and social engineering attacks. Never trust ransomware groups. Even if BayMark had paid the ransom, there was no guarantee that RansomHub would delete the stolen data. In many cases, ransomware gangs sell or leak data anyway, so paying rarely guarantees safety. Incident response plans are critical. Having a predefined cybersecurity incident response plan can make the difference between quick recovery and long-term damage. Every business should regularly test backup and recovery systems, have a clear chain of command for cyber incidents, and work with cybersecurity experts before an attack happens. The BayMark ransom attack is a stark reminder of how vulnerable healthcare and business data can be. Cybercriminals are becoming more and more aggressive, and protecting sensitive information is no longer optional. It's essential. If you found this episode helpful, hit the subscribe button to stay ahead of the latest cybersecurity threats. And if your business needs expert cybersecurity protection, visit us at www.getopos.com for cutting-edge security solutions to keep your data safe. Stay vigilant, stay informed, and we'll see you next time on Hack of the Week.